So ABDM is, when you say Ayushman Bharat digital mission, it's basically it's a framework which will connect all the healthcare system in the digital form. So currently what we have, when you go to a hospital, even if they are keeping your digital records, and then they give you they give you a printout copy and you keep it. But if you want to access it, you can access it only through their app. But suppose you go, then you go to a Vedanta, they'll have their own system. You go to Apollo, they'll have their own system. But if there's no exchange of information between these two hospitals for a patient. So if a patient goes from one hospital to the other hospital, either they have to carry their records in a paper or a file, and which creates a problem. So what ABDM is doing is actually taking away this tyranny of carrying a file or a jhola of records from one hospital to the other. So all your records will be available in a digital form, and if they are in a digital form in one hospital, they can be accessed in the digital form in the other hospital. So the interconnectivity, interoperability of records will be there. So the fundamental thing about ABDM, it's like data is in a federated form. It is not stored in a government is not keeping all the data about all the digital records in one central location. The data stays where it is. So if you go to a hospital, your reports or your diagnosis or your prescriptions are all there. If you go to a lab for a test, the reports are there. But when you want them to be shared with any other doctor, at that point of time, the system which requires, the doctor which requires it requests, you give a consent, and then it is transferred electronically from one place. So the data is as secure as it is in the current system right now. So wherever the hospital have their own security system, so it is secure. And one thing we also do that whenever a system is coming on board, we ask them to get a security testing done. So every system is secure. So the security of the system, the data remains in the best form where it is possible right now. In terms of cost, it will be there if a hospital or a lab which is not IT enabled right now, which they don't have an IT system, so that they have to anyway invest. When we are looking, we had this whole session on future of diagnostic labs and also. So IT is something which every system is already, every hospital or labs are already investing in. There is a very limited effort which goes into making a system ABDM enabled. So when you are able to exchange data from one system to the other, and actually it will be a lower cost if I take it, because suppose you want to talk with let's say Vedanta, Apollo or any lab system, they want to electronically exchange data, they'll have to develop systems. Each and every system has to do the development. So, but now if you do ABDM enabled, you can talk to multiple systems which are all ABDM after doing one effort. So the cost will be low, and overall cost is also low. When we have seen that some systems, some companies have gone live within 1 month. So the total effort is very less than 2-3 man-months of effort. IT system, so the cost is not there, and we also are having a digital health incentive scheme right now. So every record which is getting created and it is linked, if you are a ABDM enabled system, there is we give some incentive for that, and I think that would be you'll be able to compensate for that within this small phase. The amount of money that we have rounded is up to 4 crores that you can get for ABDM enabled records. So I think that would take care of the cost.